let's move on to the next question, sir. Okay, so we have a question from Jyoti that says, "Hello, doctor. I have been having a uric acid problem for a long time, and it has stopped, but suddenly it started once again. I have stopped eating non-veg and oil food, but after that, I am also facing."
Okay. Again, having issues with uric acid can lead to gout, right? So the primary, most important thing we need to do is absolutely focus on your diet, in which it seems like they've done that. Again, the low sodium comes into play, low purine diets, staying away from red meats and stuff like that, which they've done. They're focused on a vegetarian diet. Talking, obviously, no, I mean, things like staying away from alcoholic beverages and stuff like that, staying away from seafood, shrimp, and all these things that can worsen the uric acid levels. We definitely need to.
So I'm sorry to interrupt again, but the patients come back and it's confirmed that he does have gout. So
Yes.
maybe you just factor that in.
Yes. Yeah. I mean, essentially, that's what it means. So I guess I was trying to get to the point that, in general, the uric acid, usually high serum concentration of uric acid, essentially means that you have gout, and it can actually start depositing in certain joints. And again, this is for the general public as well as Jyoti. Thank you, Jyoti. It can deposit in the joints that can lead to joint pains and stuff. It can also lead to kidney disease and other issues. Now, how do we treat it? Well, again, the focus is going to be the diet. Again, great work on employing that, focusing on a little bit of weight loss. That's going to be important as well. Now, beyond that, we're going to get to a state where we may need to initiate medications. So typically we would follow the uric acid levels, and we would employ certain medications like allopurinol or Uric. So these are targeted therapies that we would use to try to lower the uric acid levels. Now, there's another set of medications that we typically use when we're having what's called a gout flare, and that can vary. And again, these are discussions that needs to happen with your physician. We typically use certain things like colchicine, and sometimes if we have any issues with kidneys, we use certain things like prednisone. Again, not medical advice here, because we probably need to look at each individual person and kind of decide which direction to go to. There's another infusion that we sometimes employ. We have certain patients who have systemic gout, and they have these crystals, tophaceous gout, which essentially you have crystals in your elbows, knees, joints, and it's actually an extremely painful condition. And we employ this infusion called pegloticase, and it has been rather very effective in these patients who are having severe gout problems.
So can you repeat the name of the drug again, if that's okay?
It's called pegloticase. Cristexa is a trade name for it, but again, probably is offered in India. I have to look at that. Sure.
He's also complaining about having a lower stomach pain, and it's like suddenly, like there's a sudden onset in the middle of the night. Do you think you'd recommend anything for the pain, or?
Again, same person who is having similar stones or abdominal pain. Again, this will have to be a conversation to kind of tease out exactly what's happening. Could it be that if there's a stone that's passing that's causing spasms, and that could be potentially causing some of this pain problems? That could be a possibility. Again, we may need to do some imaging to look at, okay, what's exactly happening if there's an obstruction to the flow. If there's something like that, if it's actually a stone related to uric acids, we may have to go and retrieve the stone or do a certain intervention for that itself. So again, my recommendation would be definitely talk to your primary care doctor, or even possibly nephrology or urologist, to see what exactly could be going on. But I do feel like it's something that we need to look into.
Okay, so I think Mr. Jyoti has probably heard you. I think it's best that he go get it checked out. And thank you so much for helping us out with this.
Oh, absolutely.